The hematologic system, blood represents its own organ system, has specific functions, control of bleeding by clotting, delivery of oxygen to cells, removal of carbon dioxide from cell, removal and delivery of other waste products to organs that filtrate and remove them. Made up of solid components. These are red blood cells, white blood cells, platelets, and plasma. All of the cells and platelets are suspended in plasma. Medications can affect some components of blood. Blood clotting. Aggregation of platelets is body's most rapid and initial response to stop bleeding. Clotting factors are a group of proteins produced in the liver and released into the bloodstream. Once activated, clotting factors from clots. Once activated, these clotting factors form clots through clotting cascades. Coagulopathies. Abnormal clotting of blood can occur when body forms clots too readily or patient clots too slowly. Certain diseases make patients prone to poor clotting. Advanced liver disease, hemophilia, von Willebrand disease. Identifying patients with coagulopathies. Certain medical conditions in which the normal ability to form clots can worsen patients' disease. Patients with prescribed blood thinners, more prone to have life-threatening bleeding when injured than patients not on these medications. So you're looking at patients that have, a lot of times these patients have abnormal clotting in that they have less clotting factors. So if you go back, these clotting factors are what are part of that clotting cascade process. And so if you're based on either medical condition or medications that you're taking can affect these clotting factors. Blood thinners are specific medications that affect that area and can make patients more prone to those life-threatening bleeds. So another reason, super important to be doing your full assessment and not just getting what medications patients have, but understanding what they are taking and what it's for. You may not memorize all of the medications that are blood thinners, but you certainly can look it up or ask the patient. Emergency treatment. Take appropriate standard precautions, perform a primary assessment and care for any immediate life threats, obtain a history from the patient and identify which specific blood thinning medication he is taking or which bleeding disorder he or she suffers from. Notify the hospital as early as possible. Emergency treatment. Monitor the patient for the development of the signs and symptoms of shock or decreasing mental status. Administer supplemental oxygen if the patient appears to be in shock or has decreased mental status. Transport to an appropriate receiving hospital. So it's always important if you have patients on blood thinners is you're always thinking of managing your outward bleeds because they should and can bleed much more significantly, but you're also thinking of internal bleeding because they're taking medications that are upsetting that balance of your clotting factors. If a patient has an internal bleed, it might not be able to manage it on its own, and that would require the need for surgery and monitoring to make sure that we're not having anybody go into hypovolemic shock due to that internal bleeding. Anemia is a lack of normal amount of red blood cells in circulation. Acute anemia would be your sudden blood loss. Chronic anemia is recurrent, can be from recurrent heavy menstrual periods, slow GI bleeding, diseases affecting bone marrow or structure of the hemoglobin. Sickle cell anemia, genetic disease affecting red blood cells, most commonly occurs in patients of African descent. Defective shape resembles a sickle. Cells have a short lifespan leading to chronic anemia. Complications of sickle cell anemia include destruction of the spleen, sickle pain crisis, acute chest syndrome, priapism, stroke, and jaundice. It is estimated that 1 in 13 African Americans has the sickle cell trait. Sickle cell trait doesn't always lead to complications. Treatment: administer supplemental oxygen, monitor for inadequate respiration, monitor for signs of hypoperfusion, transport to a stroke center if stroke is suspected. The renal system. Components: 2 kidneys, 2 ureters, 2 ureters, and 1 urethra. Kidneys are essential for life. They filter blood, remove certain waste products, excessive salts, and excessive fluid, maintain fluid balance. When it comes to your vital organs, when we talk about looking for signs of shock, we often focus on the heart and the brain. That's kind of what we deal with in the emergency side for the most part when we're looking at those immediate life threats. But something that's used in the hospital setting and should be on our minds always is the kidneys as well. Kidneys are essential for life, and they can lead to pretty immediate shock if you have major kidney failure. When you're looking at your maps for blood pressure, one of the maps that we're looking at is map of 60. If you guys remember us talking about our vital signs, that mean arterial pressure of 60. And that's not a perfusion rate for the heart and the brain. That is a perfusion rate for the kidneys. And that's how important the kidneys are. Is we're always trying to keep that intact so that we can maintain the kidneys' function. That filtering blood, removing waste products and excessive fluid, and maintaining a fluid balance. So renal system, very, very important. Diseases of the renal system affect many different portions, range from minor to life-threatening. UTIs, most common disease that afflicts the renal and urinary system, caused by bacteria, usually limited to the bladder, causes pain and frequent urination. If left untreated, can result in pyelonephritis. A UTI ascends up the ureter and into the kidney. So basically, you're getting that infection of the kidney. Kidney stones, usually made of calcium and formed within the kidney. When in the kidney, they usually cause no symptom. When they become dislodged, can cause severe unilateral flank pain. Patients may report nausea and vomiting as well. Kidney stones are extremely painful. If you go on a patient with kidney stones, they're going to be in pretty severe pain. Patients with urinary catheters. The need for the urinary catheter. Obstruction of bladder outflow, possible neurologic disorder. These patients use urinary catheters to drain urine. Commonly inserted in the urethra, may be placed through the skin. Complications of UTI and may have complications of UTI and local trauma at the site of the catheter insertion. Renal failure. Occurs when kidneys lose the ability to adequately filter and remove toxins. Acute failure typically results from shock or toxic ingestion. Chronic failure may be inherited or secondary to damage from uncontrolled diabetes or hypertension. End-stage renal disease. This is your irreversible renal failure. Requires dialysis, whether it's hemodialysis or peritoneal dialysis. 90% of people with end-stage renal disease are going to receive hemodialysis in specialized centers. Vast majority of more than 450,000 Americans on dialysis who are treated in dialysis centers undergo 3 treatments a week, each lasting 3 to 4 hours. Only 8% treat themselves at home. ESRD patients often rely on EMS for transport to and from dialysis centers. Hemodialysis. A patient connected to a dialysis machine that pumps blood through specialized filters. 2 large catheters create a circuit by which blood is removed from the body, filtered, and then returned to the body over several hours. Here's a good picture of kind of how the dialysis process works. Two types of access to the blood circulation, a 2-port catheter or an AV fistula. So here's a 2-port catheter for hemodialysis. And then here's a fistula. This connects an artery and a vein in an extremity. So you can see back here, you got the vein and the artery connected. And this is something we do not want to be doing, any blood pressures on the side of on the arm that has a fistula in place. Peritoneal dialysis uses peritoneal cavity's large surface area, special fluid infused into the abdominal cavity and left for several hours to absorb waste and excess fluid. Fluid is then removed and discarded. Continuous ambulatory peritoneal dialysis, gravity exchange process repeated several times a day. Continuous cycler-assisted peritoneal dialysis, machine used to fill and empty abdominal cavity while the person sleeps. Medical emergencies in end-stage renal disease. Medical emergencies encountered in patients with ESRD can be broadly divided into 2 groups. Those that arise from the loss of normal kidney function and those that are complications of patients' dialysis treatments. Vast majority of dialysis patients have other underlying diseases such as diabetes and high blood pressure. So you're always wanting to do your full assessment, get the full picture, and then decide what, then kind of make your treatment decisions and working diagnosis decisions. Complications usually relate to patient missing dialysis. Present with signs and symptoms similar to congestive heart failure, shortness of breath, edema, electrolyte disturbances. So remember, the kidneys are helping with that that filtration, but also maintaining that fluid balance. So very common if they miss dialysis that they're going to have that excess of fluid, causing those CHF-like symptoms, that edema with shortness of breath, can often result in pulmonary edema. And then electrolyte disturbances, very common too, because they miss that filtration, so their electrolyte balance is off, because that's the normal kidney function. Care for ESRD patients who's missed dialysis, assess your ABCs, obtain vital signs, place patient in the position of comfort, administer oxygen, consider the use of CPAP, monitor vital signs closely and have an AED ready, transport to facility capable of dialysis. Complications of dialysis: bleeding from AV fistula site, clotting and loss of function of the AV fistula, bacterial infection of blood due to contamination at AV fistula or dialysis catheter site, causing peritonitis. Just to go back for a little bit, so you have your monitor vital signs closely and have the AED ready. This isn't just because these patients are often, critical patients where you have that pulmonary edema and need to treat those ABCs. A lot of I want to kind of notate that AED portion right there. When you have these electrolyte imbalances, and the body not having been filtered appropriately, because that dialysis treatment is essentially providing the function of the kidney. When you have that significant of electrolyte imbalances, it can mess with your heart pretty significantly. And so these are patients that are at risk for cardiac dysrhythmias of many kinds, that can lead fairly quickly into cardiac arrest. So it's just something that you want to keep in mind when you're having a patient who's missed dialysis. There certainly could be a cardiac component to it. So you want to make sure that you're getting ALS on the way, and being able to print a 4-lead and 12-lead for your either paramedic that's meeting you at scene, or if you're in a system where you're transporting the patient, getting a 4-lead and 12-lead printed for the hospital when you get there. Just wanted to kind of make that note because that's a little vague with have the AED ready. But certainly also you're looking for assessing those ABCs, and monitoring lung sounds for that possible pulmonary edema as well. And that would be the reason for the CPAP, is that pulmonary edema, as we've talked about before. All right, complications of dialysis: bleeding from the AV fistula site, clotting and loss of function of the AV fistula, bacterial infection of blood due to contamination at the AV fistula, and that's the arterial venous fistula, or dialysis catheter site. Care for these patients: you're assessing your ABCs, control bleeding, use direct pressure, elevation, and hemostatic dressings as needed. If bleeding cannot be controlled by other means, a tourniquet should be applied. Administer oxygen. Treat for shock, keep patients supine and warm. If peritonitis is suspected, transport dialysis fluid for confirmation. Kidneys are the most commonly transplanted organs. So kidney transplant patients. Kidneys are the most commonly transplanted organs. Approximately 21,000 transplants per year. Patients spend their lives on a special class of drugs. This helps prevent organ rejection and increase susceptibility to infections.